Hello and good evening. It's 8 p.m. UK time, so you know it is time to start our IVF webinar. I hope you had a wonderful weekend and are ready to get some information and learn a little bit more on traditional Chinese medicine after failed IVF. Of course, here you can see her already. Laura Bicker has joined us once again. Hello, Laura. How are you feeling tonight?
Hello, I'm okay. I have got a tickly cough, so I will apologise. I'll probably cough a bit tonight.
So, of course, we understand that's not a problem whatsoever. So, thank you so much already for joining us once again. This is our third webinar with you, I believe. So, I am very, very happy and excited to have you back with us. And also, I would like to thank you for bringing that topic. This is definitely interesting, and I'm sure we will have more, lots of questions from you. So, let me just briefly tell you a bit on everything that we have brought to you. And of course, all those Strong Get Together events have been brought to you. So we can help you out a bit with your questions, but also we want to give you opportunity to to meet the top fertility experts, but also all kinds of acupuncturists like Laura today, but also fertility specialists and coaches, etc., etc. And as you know, there are plenty of ambassadors and partners that have been supporting this initiative, and I also want to thank them for their support. As you can imagine, it would be very, very difficult to simply bring all those events to you without their help. So thank you so much for that. And as I've already mentioned, tonight we definitely have an interesting topic. And so Laura will start with her presentation, and afterwards it will be time for your questions. So remember, just type those in the chat section and Laura will answer them for you. So don't hesitate. Anything that's on your mind, just go ahead and do it. And I believe we can go ahead. Laura, are you ready to begin?
I'm ready. Thanks for having me, Caroline.
Thank you so much.
Just those of you who don't know me, I'm a Chinese medicine practitioner and I work in the northeast of England. And so I've worked mainly with fertility since 2006. And I wanted to do maybe something a bit different this time and just try and talk a little bit more about the theories and the language behind Chinese medicine and how we look at IVF in a different way. So one of the things that I see a lot in terms of Chinese medicine and how people think about it is they hear us talking about things like qi, and it sounds very alien and abstract to people who don't understand Chinese medicine. And sometimes that can put people off. So I thought if I could talk a little bit more about these things, then hopefully it would help you understand how a Chinese medicine practitioner works and how it can maybe help you on a different level. We don't really know the exact origin of Chinese medicine because it predated written language. But what we know is that the descriptions and the writings about Chinese medicine that were written about 1076, 1766, can't get words out tonight, BC. The things that were written talked about things that had gone back as far as 2000 years. And acupuncture and Chinese medicine weren't exclusive to China, but because China were real experts at observation, they became more highly developed in these skills. So it was more dominant in the East. And the Chinese language is very pictorial. And so you have to remember that this is an ancient medicine. And, you know, it was very rooted in very spiritual and philosophical times. And the language we use really reflects those historic roots. But when you really start to get to grips with it, it does make a lot more sense than people often realize. So most patients who seek out support for fertility or IVF, they think firstly about acupuncture, but Chinese medicine is a full medical system, and there's much more than acupuncture within our toolkit. So obviously acupuncture is the first thing that people think about, and if you don't know what acupuncture is, it's just the insertion of very fine needles at specific points across the body. Within acupuncture, we also include what's called electroacupuncture, and this is used quite a lot in fertility treatment, particularly when we are really trying to stimulate the ovaries. And this is where we attach electrodes to the needles. It sounds very scary, and it's really not as bad as it sounds. If you think about a TENS machine, or back in the 90s when you had those pads that you'd attach to stimulate your abs, those really low level electrical stimulations, they are transmitted down the needles just to apply stimulation to the needles. We also have cupping. A lot of people are aware of cupping. They've seen the marks that the Olympians have had on them when they've had cupping. And cupping is what's called an adjuvant treatment, and it helps enhance the acupuncture by increasing blood circulation and lymph. We also use something called moxibustion, and that comes in very different forms. We can have it in rolls. You can use the loose punk and form it into cones. And you may have seen pictures. You can see the picture on my slide. That's using what we would describe as pole moxa, and it's like a cigar shape. And moxibustion is made of a particular herb called aye, and we burn it because the properties of those herbs in Chinese medicine increase circulation and it breaks up blood. We use it in miscarriage treatments, and the theories are that you still get some of the benefits of the herb from burning it, but it also gives heat out at a particular level that really penetrates deeply in the body. And the smoke has quite a calming effect on the body as well. In a lot of modern clinics now, we use less moxa because of the smoke and the intensity. And we have what are called TDP lamps, which give off infrared heat as well. But we use heat within our treatments. So these are things that you might encounter. Chinese herbal medicine comes in different forms. You'll find it in dried herbs that you boil, or more often now you'll see lots of granulated herbs because it's more practical and easier to use. And I describe it to my patients as being a bit like instant coffee. And also we look at diet and lifestyle, not so much in the traditional sense of proteins, fats. We look at the energetics of foods and how they suit a person's constitution. So if you're generally a very cold person, we don't want to see you eating lots of salads and large amounts of fruit, which is raw. We want to feed your body with warm foods like soups. And so we look at all of these things, and these are all parts of our treatment. And so these are things that you might encounter if you're having treatment with a Chinese practitioner. Two of the main things that a practitioner is going to look at when you come to see them are, firstly, what's the state of your qi and blood? So what is qi? Qi is quite a complex thing, a philosophy. But if you were really going to just break it down to something very simple, it's a way of just describing energy in its many forms and how it impacts the body. So for example, gu qi is the energy we get from food. And we eat the food, we take that gu qi into our body, and the spleen and the stomach process it. Now, we describe the positions of organs and parts of the body in different ways as well. So the spleen and the stomach are in what we would call your middle jiao, your middle burner. And they process that food, and then they send the gu qi up to your lungs in your upper burner. So if we think about that in terms of Western language, really what we've just described is you digesting some food, your body absorbing the nutrients into the blood, and then the blood is sent to your lungs for oxygenation. So, I'm starting hopefully to make a bit more sense for you in terms of the language that we use. So the gu qi combines with the air in the lungs, and it then becomes something called zong qi. And zong qi is involved in different roles in the body in Chinese medicine. And it works mainly with the lung and the heart. And it helps with involuntary processes like breathing or your heart beating. So if you have strong zong qi, you will have strong voice and good circulation. So on the reverse of that, if a patient comes into the treatment room and they have a very soft, quiet voice, or they tell you that they've got poor circulation, or there's signs there that show those things, we know that maybe there's some things going on, maybe with the diet, with the lungs. the heart. It starts to give us clues as to parts of the body that might need attention. Some of that gu qi that you get from your food passes through the lungs and then goes to the heart, where it combines with other types of qi. So we've got yuan qi, which is the foundation of yin and yang in the body. And it also combines with the kidney qi. And those together all form blood. So if we go back to the Western language again, in Western medicine, the kidneys are said to control the production of red blood cells in the body. And what they do is they signal hormone production, which then activates blood production in the bone marrow. So, the language is different, but again, the processes are still quite similar. And so there we see how qi generates blood. So if your qi is deficient from poor diet, lifestyle choices, illness, so on, then your blood is going to be impacted. And blood is how your body feeds your organs, how it heals itself. Your blood sends everything around your body, those nutrients, to help it function. So qi also moves the blood. Now, if you think about qi and energy and think back to your physics lessons at school, how energy is moved and transferred. For blood to flow, the qi needs to move it. If your qi is deficient, for the reasons I mentioned before, then your energy flow is going to become stagnant. And then your blood will eventually develop what we would describe as stasis. So if you imagine a scab, how your blood coagulates in that area, that's a bit like what we're thinking of in terms of stasis. So from a fertility point of view, we're talking about things like fibroids, endometriosis, also just clots in your period if the blood flow isn't good. Hopefully, you can see how things that sometimes seem strange are now not always so different. Now, you also need to hold the blood. So the qi holds the blood. Now, an example I liked is if you think about when you're trying to kind of drink water from a tap with your hands, if your hands are weak, then your palms won't form that seal as effectively and the water will flow through your hands. So in a similar way, if the qi is deficient, your body won't be able to hold that blood and control the flow of the blood as well. So you might see things like spotting or flooding with periods. The blood also nourishes the qi. And so what we see a lot in Chinese medicine is that a lot of these relationships are mutually dependent. Different parts of the body all need to work together. And qi and blood have this mutually dependent relationship. So if you think about that blood is well nourished, it's had everything from the gu qi and everything else it can have to make it full and good quality. Its job then is to flow around the body and feed all the organs. And if the blood is deficient, then it won't be able to feed the organs and they won't be able to make good quality qi. So you need good quality blood to then nourish your qi. So think again to things like that zong qi I mentioned before. Your body needs that blood to form that quality zong qi. Hopefully I haven't lost you yet. So, sorry, I'm skipping ahead too quickly. Deficiency in excess is another concept that your practitioner will look for. So I've explained there how qi and blood can become deficient. You also have yin and yang energies. The yin and yang energies can describe so many things. Yin is dark, yang is light, yin is woman, yang is man. And in the body, the yin is the blood, the fluids. So if your body is not nourished or you're overworked, the yin can become deficient. And similarly, the yang can become deficient. And from a fertility point of view, the yin is your estrogen and your yang is your progesterone. Jing is your life force. And some of this is determined by genetics and some is by lifestyle again. So I think a really good example of this is Captain Tom 100 years old, doing his laps in his garden. That guy had a lot of Jing, and he still has a good level of Jing for his age. It's really like your life battery. And, you see that as well, how some people age more quickly than others, graying hair early, that kind of thing. So a practitioner will look at somebody's Jing and see if they need to tonify that and try and support that to improve the quality of eggs and things like that. The other things that we can get is excess conditions. And so we can have things like excess heat in the body. An example of excess heat would be, for example, somebody who has been having too heating a diet, lots of alcohol, lots of spicy foods, have then generated heat in the body, and that would be an excess condition. Dampness can also accumulate in the body, and again, diet is a good example of this. If you eat too many rich, fatty, cloying foods, then they will create a situation of dampness in the body. So if you think of somebody who's eating lots of processed high sugar foods, they're maybe not getting enough nutrients and vitamins from fruit and vegetables. That'll create a state within their body where they'll have lots of dampness, but probably a bit of deficiency as well. And then they're going to be prone to conditions like candida. Other examples are stasis. So we've talked about that blood stasis and how stasis can accumulate, and in excess levels, it's going to really produce symptoms like endometriosis, fibroids, and patients tend to have very fixed focal stabbing pains with stasis. So the body gives us clues to all the different things that are going on. Another thing that we can get is stagnation. And when the energy doesn't move the chi in the body, you will develop stagnation. So this is kind of a favorite of mine because stagnation is so common. All of us can have stagnation to some extent, but it's really easy to treat, particularly with acupuncture, and herbs work wonderfully for stagnation. So I'll give you an example of, probably 90% of the women I see in clinic are what we describe as type A. The type A woman really takes pride in herself. She wants to do her best. And when she feels like she's falling short, she puts even more pressure on herself. And then that builds frustration and tension and rage even in the body. And if you think about, your body tenses up, it's like kind of fizz in a bottle of pop building. And eventually that bottle of pop is going to explode. And so what you get is emotional outbursts like PMT and mood swings and feeling depressed. And often stagnation can come from things like unfulfilled desires. And, type A women are often kind of spinning a million plates because they're trying so hard, but they're also not very good at asking for help. And so that inability to kind of achieve what they're trying to do in their mind just creates more stagnation. So those kind of patients will have things like breast tenderness, menstrual cramping, and, by getting that chi moving, releasing that stagnation, we can very quickly resolve a lot of these symptoms. So the Zhang Fu organs are a group of main organs that we look at in Chinese medicine. And this is another issue that I see people struggling with the language of Chinese medicine, because when we talk about our organs, we're not talking about the physiological organs that we think of in Western medicine. So often when you speak to patients and you start talking about deficiencies in their kidneys and things like that, they become a little bit anxious because they think, is there something wrong with my kidneys? And that's not always the case. We're mainly talking about this energetic level of what's going on within the body. That's not to say that, there can't be pathologies present, but that's not really what we're trying to articulate in our diagnosis. So things like, deficient qi, yin, yang, they all form parts of our syndrome differentiation. And that's really what we're looking at when we're trying to diagnose. We're trying to decide what somebody's syndrome differentiation is. So is their qi deficient? Is there blood stasis? We're looking for these symptoms and signs that put pieces of puzzles together and tell us which parts of the body need attention. And that then starts to tell us what organs are involved. So, for example, most of the time with qi stagnation, the liver is involved. And for example, that will affect things like ovulation. So you can see from this slide, the organs are split into yin and yang, the hollow and the solid organs. And when we are selecting points, we will then look at, well, this person's got liver qi stagnation, so I'm probably going to use some points on the liver meridian. And you can see how those things start to then help plan and build a treatment. And we're not necessarily saying that person has a physiological issue with their body. So getting back to the whole IVF side of things, you've had a failed cycle, what next? First of all, we have to work out why that cycle has failed, and you really need to find out what the feedback is from a clinic, because that is going to probably dictate your next part of your journey. And then how are we going to kind of accomplish what we're trying to achieve? How can we make things better? The most common reasons for failed IVF cycles are poor ovarian response to medication. And so your Chinese medicine practitioner is going to look and say, well, what is the qi in blood like? Is there good circulation to the ovaries? We know that acupuncture has a fantastic effect on the pulsatile index and improves the blood circulation to the ovaries and the uterus. How's your Jing? Do we need to nourish and support the body's Jing? Are there lifestyle factors that are affecting your body? Can we give you some advice on how to change some of the things that you're doing, what foods you can eat better to improve those things? How can we strengthen your body and just prepare it for your next cycle? And then we're going to look at how can we calm your mind and help you relax so we can get that qi moving smoothly. Another reason that IVF cycles commonly fail is poor embryo quality. So for embryo quality, we're really going to look at both sides because male factor is equally as important. And often I would say that it doesn't always get looked at as much as it should. So we're going to see, does he have any deficiencies or excesses? What are his lifestyle factors like? Are they conducive to good fertile health? Is he being ignored in the process? Are there signs that actually there's something going on that's been missed on the male fertility side? One of the things we kind of pick up on quite a lot is sometimes we'll see patients and their clinics will have said basically it's an egg issue. And then when we look at the fertilization and how embryos have progressed, often there's been some drop off around day 3 onwards. And I think it would be rude to ignore the sperm here, because the sperm DNA, it plays 50-50 role and it comes into play at day 3. So it may be that these embryos are dropping off because of sperm quality. And just because, somebody's had a good sperm analysis doesn't necessarily mean that their sperm is what it says it is. You can have DNA fragmentation on a deeper level, and lifestyle factors and stress and infections that are hidden can also affect this. So we have to look at the male. Is there signs of infection? Is there signs of heat? Is there anything else we can improve just to try and up the quality of these embryos? Stress, bad diet, these all affect sperm quality and therefore embryo quality. Another common reason that IVF cycles fail is a thin endometrium or a kind of poor quality endometrium. So again, we're looking at that qi and blood circulation. If the circulation is good, then the endometrium is good. If it's poor, then it's going to have an impact on how implantation occurs and how placental development, how good quality that is. And that can then increase chances of miscarriage if it is not good quality. So as a Chinese medicine practitioner, we're going to look for signs of blood stasis again, signs of blood deficiency. Is this patient yin deficient from our perspective? Are we seeing night sweats? Are the drugs having an impact on their body that it's really drying and draining the resources in the body so that we need to tonify that body and support it a bit more? Have they got low levels of estrogen? Or is there some excess heat in the body that's drying the fluids so that it hasn't got enough to nourish that lining and thicken it? So this is how a Chinese medicine practitioner can really give you a different perspective and build a treatment plan to prepare your body before an IVF cycle. Here I've given a case just to try and help you understand a little bit more how we work and how we can help somebody. So this patient of mine was a female lady, 36, unexplained infertility, and she'd been trying for 3.5 years with 2 IVF treatments and 2 miscarriages when she came to see me. She'd been off the pill a year when she was diagnosed with unexplained infertility, and her cycles were really irregular, sometimes as long as 6 weeks. So straight away, I start thinking, well, why are her cycles long? Is she ovulating really late? Why is it taking so long for her to ovulate? Has her body got a sufficient yin and blood to nourish a follicle to grow? So straight away, I'm starting to think, okay, these are things I can fix. So she was referred to an IVF clinic, and she had a histosalpinogram, and everything again was clear. So it was all still unexplained. She did her first round of IVF, and it was pretty successful. She had 13 eggs, 9 of those fertilized. At day 3, there were 2 top grade and 5 good embryos. But by day 5, only 1 good blastocyst. So again, I start thinking, okay, maybe the sperm needs some attention. That IVF cycle did result in a pregnancy, but the HCG levels were low, and they did increase, but then a week later, she did miscarry. So she had a 6-month break, and she did her second round of IVF. 12 eggs that time, all of them fertilized. Then at day 3, she had 4 top and 6 good. At day 5, there were 4 more areolas, so they were almost blastocysts. So again, there's a little clue. I'm thinking, okay, they weren't quite growing at the rate we would have expected. They were a little bit behind. So is there some kind of qi and blood deficiencies there? Things are not quite developing as we expect. This time 2 were transferred, and again, it resulted in a low HCG level and a period shortly after. At which point her clinic suggested that she think about egg donation. And she clearly wasn't ready for that. And I would say, in my experience, seeing a patient with those kinds of results, I wouldn't have expected her to go down the egg donation route, also being so, still fairly young and healthy. So you can imagine by the time she came to see me, she was pretty much at the point where she couldn't actually conceive the idea of pregnancy or being pregnant because everything had always resulted in a failure. And she would often say things like, well, nothing's worked before. Why is it going to work now? And I would joke and say, well, you've got me now. But I was fairly confident in what I could see because of those good egg response and good quality, good fertilization rate. We had a fairly good foundation there. And I could also see that her general health was not that bad. And so from my experience, I just felt like a couple of things just needed tweaking and we could probably get there. Some of the things that I picked up on were that she had a really stressful job and she wasn't sleeping enough. So I gave her a little bit of homework to focus on those things and to just try and really address that work-life balance again. She'd said that she liked yoga, but she just didn't get time to do it anymore because she was making work a priority. Her diet was good. So I gave some recommendations for her and her husband to look at. And she decided to take a long holiday, and when she came back, we started to do some treatments to focus on this blood stasis and really nourishing the spleen and this heart yin, these deficiencies that I could see in her body, and kind of help with the anxiety And one of the things that goes hand in hand with heart yin deficiency are signs of anxiety. It can be a chicken and egg situation. So really just starting to, reduce the stress and balance her body back out. So she started IVF and everything was going really well. And then COVID hit. And so obviously that was another emotional knock for her. And a lot of upset and anxiety again. But what I found was that for some people, lockdown really gave them an opportunity to address that work-life balance in a way that they haven't been able to before. And her and her partner really did start to rebuild their bodies. So she finally started IVF again, and we worked throughout her cycle on all of these factors. And her cycle, she had 16 eggs, 8 fertilized, and she had 1 blastocyst on day 5. And still at this point, she was fairly negative because the pattern had followed very similar cycles before, not many blastocysts to transfer. But I saw her in a 2-week wait, and what I could see was that she had very good kidney energy. Her pulse was really strong, and that's the thing that we look for in Chinese medicine. And because of her history of miscarriage, I used herbs to support her pregnancy, and she got past that 6-week stage that she'd never been past before, past the 8-week stage, which for me is really crucial because once you get past 8 weeks, that chance of miscarriage reduces to less than 1%. And she had a 12-week scan and baby was healthy. And she's now, progressing along beautifully. So I think that's a nice example of how we can look at a failed IVF cycle and find the things that just need tweaking a little bit to give us that successful pregnancy. Go to the questions now, I guess.
And wonderful. Thank you so much, Laura, for bringing again this topic. Definitely interesting details you have provided, and so many interesting options for our patients as well, for sure. And yes, you are very right. It's time for our questions, and as you can see, there are plenty of those questions ready. But also, I do see some people are typing, so I guess we can go ahead with the questions, and let's have a look at the very first one. One question for late. So, would Chinese medicine be an alternative for cases where both eggs and sperm are fragile and with poor quality, in situations where no embryo reach blastocyst?
What I would say is I don't have enough information on the case to, say that that would be a possibility. We need to know why you're doing IVF in the first place. What's the AMH levels like? There's always a potential that we can improve things to a level where natural conception can occur, but we have to be smart about things and think, well, how old is a patient and what's going to get them there first? If you can do some work prior to an IVF cycle potentially to really build and support the body, then the results of a following IVF cycle could be better. But I would suggest, speaking to a Chinese medicine practitioner and maybe having a consultation so you can go through everything. But they will be really realistic and pragmatic about it as well. We can't do everything, and time is a big issue for a lot of people. And some of the work we do, particularly if there are really deep-rooted deficiencies, like with the Jing, if the Jing is very, very deficient, then sometimes the work would take a lot longer than most patients are willing to give it. But I'd say it's definitely an avenue worth exploring.
Wonderful. Thank you so much for your question, indeed, of course, and you, Laura, for your assistance. And remember, in a minute, I will send you a link where you will be able to simply get in touch with Laura, and I'm sure she'll be more than happy to provide you with more details. She just needs some more details as well, of course. Thank you for that. And let's have a look at the next question. So, what herbs can be taken to improve egg quality?
So again, the thing with herbs, there's no magic herb that cures all people. With Chinese medicine, we're very bespoke about what we do. And this is where the syndrome differentiation comes in. And there's kind of a saying in Chinese medicine that you can have the same symptoms and you'll get a different treatment. And then you could have completely different treatments, symptoms, and get the same treatment. So, for example, you could have poor egg quality because your Jing is deficient and because you have kidney insufficiency. And so what would happen is your practitioner would look at all the symptoms and signs, your full health history, your menstrual history. They'll even look at blood test results and see what your hormones are up to. And then they will formulate a Chinese herbal formula is how we would describe it for you, and they'll put different ingredients in depending on what's specific to you. So then they would produce a completely different formula for somebody with different symptoms and signs.
All right, amazing. Thank you so much once more for your question and your assistance. All right, and what herbs can help to decrease fibroid?
So it's the same answer again, with the syndrome differentiations, for most conditions, there's going to be maybe 3 or 4 different potential syndrome differentiations that we see commonly in clinic. And so, a practitioner is going to ask the questions, see which kind of category you fall into. And then, there's no very hard or fast rules. If one of them is qi deficiency, one of them is blood deficiency, one of them is heat. That's not to say that you can't have a combination of different ones within your syndrome differentiation. So again, they're going to tailor it specifically to what's going on in your body.
All right. Thank you once more for that. And of course, next question is coming up right now as well. So how did you help the sleeping qi deficiency and hardin deficiency of the case study?
So for the case that I saw recently, the spleen qi deficiency, we did a lot of work with the lifestyle stuff, just looking at foods that are not nutritionally, energetically good for the spleen. So for example, having things like porridge for breakfast, the change in the way she cooked her foods. And trying to eat just really warm, simple, easy to digest foods will help support the digestive system. The heart yin deficiency in the spleen, again, I also used specific acupuncture points that fitted the diagnosis. And what I tend to do is just change depending on how someone's feeling on the day that I treat them and what I know from their case history. And then with herbs, we used herbs to support the spleen, to nourish the yang during the pregnancy, to help support the progesterone levels. So it's just tailored. And that's one of the beauties of Chinese medicine. Everything is tailored to the individual and what we see at each time. It's not just one size fits all.
And huge thanks once again for explaining that to us once again as well. Next question is also already, how can Chinese medicine help prepare for frozen embryo transfer?
With a frozen embryo transfer, it's no different really to any other cycle, other than we're not really worried about what follicles you're going to produce and how your eggs are going to be. So we would again look at how good is the lining, how good are your bleeds, do we need to give your endometrium a bit of a kick and give it a good clear out for a few cycles. Energetically, what are you like? And that way a practitioner would plan how long maybe you'd need to have a bit of prep work. It may be that, there's male factors involved more so, and a little bit of prep work is enough, and some treatment throughout your stimulation on the build up to your transfer, and then working with you through your transfer and beyond would be enough.
Understood perfectly. Once again, thank you so much for this. Of course, there are more questions coming up, and next one is, I have scar tissue in my uterus. Are there any options for that?
This would really depend on the severity of the scar tissue, the position of it, and what your consultants are saying the options are with your scar tissue. For some things, the herbs, again, there's potential that they can help with scar tissue, but in practice, if it is really pronounced, have we got enough time to really work on that? There's possibilities there, but it also, it all depends on what the actual situation is in your individual case.
Of course. Thank you for that advice. as well. Next question, we have like two parts of it. Okay, so let me just straight away show you two of those. So thanks for the presentation. My clinic is quite anti-Chinese herbs. Can I take herbs with progenova and cyclogest, estrogen and progesterone? I'm doing frozen embryo transfer from double donor. I'm 44, no fertility issues except for age.
What I would say is Chinese herbs can be safely used through IVF. I understand that doctors are often very concerned about their use because, again, there's not a lot of knowledge out there about the interactions. What a lot of practitioners tend to do is they try and do that preparation work first so you don't have to combine the herbs with your medication. What I find is sometimes patients will come to me at a point when it's almost last case, last chance, and using a small amount of herbs is really the only hope we've got. And I've seen very good results doing that. But I think in an ideal situation, we try and minimize the use of herbs just to really, help keep the clinic happy, and also just know that, your body's reactions are down to the medication. So it's usually ideal that you've had some IVF cycles before and we know how your body reacts to the medication, and the medication is the same. But that's not to say that they can't be used concurrently. And if you wanted to do that and your clinic was very anti, what I would suggest would be finding a practitioner who is confident in using the herbs through an IVF cycle, and then seeing if your clinic is open to having a discussion with them.
And perfect. Once again, thank you for that. Well, next one, it's not actually a question, but I'm sure you will be able to help out a bit. And for now, at least, it seems that that might be our final question. So let me just remind everyone that if you have any questions, go ahead and type those in right now. And the question, the comment is, I get on really well with my acupuncturist and her often prescribes me herbs to deal with GI symptoms I'm suffering with. I'm just often worried it would affect things when doing an ICSI cycle. I know he would not prescribe it if it did, but I always worry, and maybe that's why I'm not too good at finishing the herbs, which I know doesn't help me either. I guess need reassurance. Anything you can say?
Again, if you're using them to help control symptoms, is your practitioner maybe stopping them just before you start your medication? If you are concerned about using them during your IVF cycle, and you are, I think you need to weigh up the benefits of how they're supporting your digestive system as well, because good digestive health is really important for fertility. And, we know a lot now about the gut biome and the different biomes within the body and how they impact fertility. I think just have a real deep discussion. And, it's really easy to find information on Chinese herbs now. There's huge amounts of data online. I would say, if you trust your practitioner, then, you've put your trust in him, go with it. I really wouldn't be worried. But like I was going to say, you can read about all of your herbs online. So, you should have all the ingredients of your prescription on your herb bottle or whatever they've been prescribed in. And it's very, very easy to just put them in online and read a little bit of information around those herbs and how they work and their actions. And you can try and find some information out about how they interact with hormones. But, just have a real good conversation with your practitioner. And if it is creating high levels of anxiety, then maybe it is a little bit counterproductive as well.
All right, excellent. Thank you so much for that reassurance indeed as well. I believe it was very helpful. And there's a thank you from Belinda for you as well. All right. And let's have a look. Okay, next question we have is right here. So still on herbs, would herbs help improve sperm quality in combination with vitamins?
Yes, they can, but there has to be a little bit of caution here, because there can be issues that arise from doing too much work. So if patients are on high levels of antioxidants and then the herbs are having a similar antioxidant effect, it can actually have like a negative effect. So again, your practitioner should have the knowledge and experience to know what you need to take with herbs and not.
And of course, that makes perfect sense. Thank you so much for that as well. Next question we also have from the previous patients. Should we only drink warm drinks? Are cold drinks bad for fertility? When to drink which one?
So that depends on you. If you are a cold person and you feel cold a lot, it goes back to this idea of energetics of food, and you don't want to be putting cold into a cold body because that's just going to affect circulation more. And we have this idea in Chinese medicine that we want the body to be warm for conception. That old kind of wide description of a bun in the oven. Your body is the oven, and we want those like yang levels to be high, and yang is like the fire in the body, the progesterone. So if you're a cold person and you're drinking icy cold drinks, particularly now when it's getting really freezing cold, then I would try and stick to warm drinks. And again, environment plays a role in this. So if you live in a very warm country, then you can probably get away with a little bit cooler drinks and things, but try and drink them more at room temperature rather than icy cold.
And excellent. Thank you so much once again for that. Next question is also ready, so let me go straight to that one. I've been to two acupuncturists. I use moxibustion, and use cupping. Is one better than the other? I also got told I have low energy. Any tips?
One isn't better than the other. They have completely different effects on the body. So we use cupping generally to increase circulation. It's fantastic for releasing tension in the muscles and drawing toxins out of the body. When moxibustion is about nourishing the body and putting heat into the body. So because you've got low energy, your practitioner was probably using some moxibustion on points that are going to help support and nourish the spleen. And one of the things the spleen likes warmth. Often what we see is patients have what we would describe as spleen yang deficiency. So the fiery part of the spleen is deficient and we need to give it a bit of a boost, and using the moxibustion can really help that. And again, with that low energy, treatments like moxibustion will help boost the energy when they're used on those points that nourish and build the qi in the body. Again, to boost your energy, going back to things like eating foods that are going to support the spleen, warm, simple, easy to digest foods. If you think about convalescence foods, chicken soup, the Chinese make congee, and it's like a rice soup where they keep adding water to the rice and then they'll crack an egg in it or they'll put bits of chicken in it. So it's really nourishing, but it's really easy to digest. So your body isn't having to expand lots of energy digesting your food to extrapolate that energy as well. But make sure you get plenty rest as well, and think about everything in moderation. The things that wear us down and deplete our bodies are things in excess, staying up too late, overwork, overthinking, overeating. Try and find balance.
And amazing. Thank you so much once more for your thorough advice on that, indeed, as well. And we have another question, and that one is right here. I live in one of Asian countries where Chinese herbs are widely available, but none are specialized in fertility. I'm afraid they don't understand how much about helping in fertility situation. How do I explain them to create herbs for me?
I would say have faith. I don't know what part of Asia you're talking about, but there's lots of research that goes on that even Western practitioners like me don't have access to because they're not produced in a language that I can read. And all practitioners who train, at least in the way I did, are taught the whole of internal and external medicine. Similar to the way a GP would, be taught to learn a little bit about everything. And so they should have some fertility grounding. It may be that they don't necessarily know the lingo in terms of IVF cycles, but they will have some basis there. And if their training is good and they've got a good level of experience, they've been practicing for a long time, and they've seen, you know, a good number of fertility patients, then they should have sufficient experience in that area. And if they're a trained Chinese medicine practitioner in herbs, then they will know how to put a formula together. And really, that's the beauty of Chinese medicine, is that to some degree, you don't always need to be a specialist, because if you have the good diagnosis and if they've diagnosed you correctly, then they know what herbs to put together to treat you. Where the kind of more specialization stuff comes in is what I really see around kind of the immunology side and the really complex cases. So patients who've had things like recurrent miscarriage, recurrent implantation failure, or they've just been trying for a very long time with no obvious reasons as to why they are not conceiving. Patients like myself who've done things like the fertility support training and the advanced diploma, you know, we've spent time training with reproductive immunologists and embryologists, so we have a deeper level of knowledge and we can translate that into our treatment. But not every patient needs that level.
And once more, thank you so much for that. Definitely interesting once again. And well, I believe that was our final question for today. So I would like to thank everyone and each of you for your questions. Definitely interesting. So thank you so much for joining in your time. Of course, Laura, it's always great to have you here, and you've been brilliant with answering all those questions, so many interesting ones. So, well, thank you so much. Is there anything else before I let you go? Is there anything else you would like to add?
I think I did make some notes. Where have I put them? I was just going to give a little bit of advice to people if they wanted it, on things that they could maybe do themselves to help them at home, because I'm conscious that's always things that people are really, they want to know. So I think if you're looking for something you can do to help yourself, it's really looking at how to relax and how to replenish your body. Can you get more balance in your life? Can you get that work-life balance addressed? If there's emotional stuff going on, if you've had, you know, traumatic things happen in the past with your IVF cycles, if you're in that position where really you can't see beyond where you are and envisage pregnancy ever again, because, you know, it's just not happened and you've had COVID and everything thrown at you along the way, then maybe doing some work with maybe a really good clinical hypnotherapist. You know, I work with a practitioner who does kind of trauma resolution therapy, and it works amazingly just to get people on a different thought pattern, or working with a counsellor. You know, I see a lot of patients who know there is a counsellor available to them at the IVF clinics, but they don't make use of it. And the ones that I see that do really benefit from it. So I think if you are struggling emotionally, then maybe try and explore some things that you can do to help you on that level, particularly as you're preparing for another IVF cycle. Again, one of the things I see is that sometimes people fall into this kind of state of just robotically going through everything because they've lost all hope and they don't know how to get into a different mindset, but they just want to keep going and they just carry on in this very robotic mode, and they're not physically and mentally in the right position to do IVF. And I think it's really important to mentally be on board and to feel, you know, like your mental health is good and you're receptive, because our emotions and how we feel affect our hormones and our body responds in different ways. So I think getting your mindset, you know, ready for IVF is really important. And looking at diet, but also not being obsessive with it, not doing anything really extreme, because sometimes the fallout of IVF is that the drugs leave your body in this really out of balance state, and doing really strict diets or really strict detoxes can be just another additional stressor. So if you feel like your body has just gone into kind of overdrive and your body doesn't feel like it's in a good place, Start by being really kind to yourself and doing those things that are going to look after your digestive system. Start really simple. Eat those warm, simple foods, porridge, casserole, soups, things that your body is going to nourish easily. Get your rest. Start recuperating before you start thinking about, right, I'm not going to have any coffee and I'm not going to have any alcohol and I'm not going to have any dairy, and getting really strict and creating another stressful situation for yourself.
And wonderful. Thank you so much for yet some more advice here. Thank you so much. And well, as you can see, there are plenty of thank yous coming up your way. Thank you very much, Dr. Laura. And excellent. Thank you for your time. Thank you very much. And of course, thank you so much. Great presentation. So many helpful tips. Amazing. And I could not agree more with all of you. So thank you so much for joining. And I do know it has been very, very useful. Remember that if you would like to get in touch with Laura, you can use the link I have just sent to you. And that way, I'm sure she'll be more than happy to provide you even more details as well. And also remember that this has been recorded, so you will be able to rewatch it. It will be available on our website, myivfanswers.com, but also on our YouTube channel. So go ahead and subscribe. And if you simply follow us on Facebook or Instagram, you will know that there are many, many more events coming up. Once more, Laura, it's always great to have you here. Thank you for your expertise, for joining us. Have a wonderful evening, everyone, and I do hope to see you tomorrow at 8 p.m. UK time.
Thank you for having me.
Thank you. Take care. Bye.
Bye.